safety is, of course, very important, and there's sort of immediate effects, and then there's longer term effects, and that's part of why it takes a little while to determine those endpoints. But with the phase 3 trials that people have heard about, this is where you really want to see disease prevention. So some of the thought behind this is making sure that not just that you're vaccinating a large number of people, but you need to vaccinate people that have enough risk that they're going to come in contact with COVID, because to see a difference between, in this case, the placebo is one of the placebos that's been used as a meningitis vaccine versus the candidate COVID vaccine. And then to see in the two groups, is there a lower rate? But you're not going to see a difference if you're in a place where there's not enough COVID. And so it's a little bit of a double-edged sword. We certainly don't want to see a lot of COVID in Michigan, but since the economy has sort of reopened and re-engaged, we have seen like this kind of rising water of cases. So, for example, one of the things I think a lot about are college students, and they would probably be a good audience to vaccinate in a trial, of course, if they were interested, and with all the usual safety measures, because their behavior puts them at higher risk than someone who maybe is staying home all the time. Healthcare workers, essential workers. But it is also important to make sure that we do these studies in large numbers of people who are older, to see how it works in older adults, since they are some of the highest risk groups for poor outcomes.